Hi, Rick Tharp of RX Kinetics, here with another Kinetics program demonstration for you. This time I want to show you how to add a new patient and how to perform prospective data on a population model. So we'll begin by logging in with your user login, 3 initials, click Accept Disclaimer. To add a new patient, you click on the Add icon on the data bar. It's the one that looks like a little plus sign. Notice when you do that, most of the other program functions are grayed out or disabled. And they'll stay that way until you click either Cancel or Save. First piece of data we need to enter is the patient name, and it has to be entered in a specific format. Last name, comma, first name. Tab to the next field, which is attending physician. Tab again if you want to for the med rec. Those 3 things are required. Location is optional. Put a room number in here, for example. Next tab to the date of birth, and this is the first of 3 or 4 different fields that you can right click on and enter an alternate method. For example, in this case, age. But notice that the date of birth is today's date, not the patient's actual date of birth. It's really important that you use the actual date of birth. That way you only have to enter it once, and when that patient comes back, you'll have an accurate age. And in this field, you can move between month, day, and year with the arrow keys, the left and right arrow keys. And then within each of these different fields, you can use your up and down arrow keys to change month, day, or year. You can also click on the drop down, which brings up a date input box. You can select the date there. Okay, let's tab down to height. The program here is accepting it in centimeters, but we can right click on that box if we have it in inches instead, and it'll do the conversion to centimeters. We can tab over to weight, and we'll click on gender, and that brings us to the other factors inputs. And these check boxes here are if the patient has chronic renal failure, you can check that, and that would be accounted for with the GELF multi-step method. It takes care of that. Liver dysfunction, it's really just going to pop up a warning telling you that there is no creatinine clearance method that's accurate in patients with liver dysfunction. Acute congestive heart failure and smoking are factors that really only affect the offerin. So let's tab down to our serum creatinine input. We enter serum creatinine, and again we come to a date input, and it works the same as the other. You can up and down arrow key between each field. One thing different about this date field is if you can press the T key, and it'll change to today's date. Once you have all the data entered correctly, you can click Save. And notice again that a lot of the other program functions become active once again. So to begin our drug dosing, we need to select a drug model. And we're going to give BB some Vanco. And there are 3 methods that come loaded in the program, 3 models, and you can read more about them in the help file on the website. My personal preference is the clearance method. This is Winter's latest method. You know, he kind of wrote the book on pharmacokinetics, so I think it works. Now that we have our method selected, let me show you one other thing you can do. If you want to use an alternate creatinine clearance method, not the ones that you've selected in our setup, you click on this button here, and it'll pop up a dialog where you can select from many different methods. 3 different iterations of Cockcroft and Galtz. Gedelef has a couple of published methods. There's the MDRD equation, which is popular these days, and Salazar and Corcoran, which is really good for obese patients. So let's use MDRD and BB, the great African-American guitar player. And click on the prospective dosing. This is our population model that we've chosen on the patient data tab. And we can see here where how the clearance is calculated. 109 mils per minute granting clearance times 0.065 gives you your clearance. The volume of distribution is calculated here based on a dosing weight. And here's your ideal doses. Now you can change some of your targets here. For example, if you give, you would be given 1,500 milligrams over, let's say, 90 minutes instead of 120. Or if you want a different peak, or I don't recommend changing the peak predict time, but you can. Target trough, or if you have an MIC, you can enter that there. Now let's look down here in our dose selection box. Loading dose is optional. Let's enter a more practical dose. Instead of 1575, let's go with 1500 every 12. That gives us a nice peak and trough. You can see, since we entered an MIC, the pharmacodynamic parameters show up here. Those look good. We can view a graph here of our dose. Again, it shows the approach to steady state, starting at 0, and when you get out here to approximately the 4th dose, you're at steady state. Shows the you're above the MIC for the dosing interval. That's important for vancomycin. Okay, we've got our dose chosen. Looks good on the graph. Looks good. Let's go to the pharmaceutical care tab. And these are things that are going to print out on your consult form. Again, we can say that, let's just change this here to say measure peak and trough levels around the 5th dose. I mean, isn't that what everybody does? And then we can choose some canned comments here. For example, a clinical pharmacist on call 24/7. You can put a nice little thank you there for doc. You can this box here is for if you want to if you're doing an intervention versus a consult. This will put a section on the form where the physician can check off whether they agree with your recommendation or not, and they can sign it. So let's look at what that looks like. Let's go up here and print a consult form, and I'll show you what that please change therapy dialog looks like. Let me change the size of the preview box here just a second. Let's zoom it. You can on the preview you can click to zoom in, right click to zoom out, so come out, and you can see there where it says recommendation. And since we have graph, it prints the graph in color if you have a color printer. And it's important that you print. I just want to emphasize that, because that's the trigger for the program to know that's the dose you've decided to recommend. And that gives you a history for that patient. That saves what you've done. That gives the next person that comes along an idea of what you recommended. So even if you don't actually print a hard copy, just by clicking on the print button here, you can save that. And once you save a consult, it shows up in the View Consult for that patient. So you can click on View Previous Consults, and it'll show a history of the dosages that you've recommended for that patient. Okay, I think that wraps up how we how to use the program to enter a new patient, and how to do a prospective dose based on a population model. I hope that made sense.